Now contrast this to this lesion. This is a cystic lesion with a very irregular border, and we can see the contrast coming into this lesion, but as soon as the contrast comes in, it leaves. So this is a relatively fast transit time. As you can see, it's decreasing in intensity right now. And when we look at the time activity curve, we can see that this lesion has, as we stated before, a very quick uptake and very short dwell time. As you can see now, pretty much the lesion shows very little of the contrast. And here's the time activity curve showing that high, relatively quick uptake and short dwell time. Now contrast that to this lesion, about a 2 by 3 centimeter ovary with a 1 centimeter cystic area. Now watch in this cancer how the contrast comes in and is very intense over a long period of time. As you can see here, the peak intensity is at 27 decibels, which is about 4 times higher than the others, and there's a very long dwell time. And this was an adenocarcinoma. This is the ovary and the other side, and you can see that it's enlarged, but note how there's marked increased vascularity in this ovary. Again, this is a patient with bilateral stage 2 ovarian cancer. And again, what we see is high peak, long dwell time. And this is the lesion itself. Here's the right ovary with a little cystic area in it, and this is the left ovary. Now, when we looked at the actual numbers, the time to peak was not statistically different in benign versus malignant. But when we look at the overall peak enhancement, there's about a 2 to 3 fold difference in benign versus malignant. And certainly the washout time is about three different, and the area under the curve is about 4-fold different in these different parameters. Now, so what we're saying is that we can look at the microvascularity, namely the capillaries, and make a differentiation between benign versus malignant. And the question is, can we do this looking at the macrovascularity? And we know for a long time that we can see in malignant lesions many more color Doppler signals. So in trying to quantitate this, we can come up with a vascularity index, which is percent of pixels or voxels in 3D with color over the total, or flow index, which is power-weighted pixel density, which relates to the intensity of the signal, or the vascularity flow index. And we can look at fractal dimensions and give an idea of vessel branching and caliper. We found in our initial work a significant difference in benign versus malignant in the vascularity index. In the power-weighted index, we also saw a very significant difference. Now, can we do this in 3D? And we're hoping that our data will show that with 3D we can do this in an even better fashion, because we have more representation of the tumor vessels. As you can see diagrammatically here, we can see more of the vessels using 3D. And in fact, if we magnify, we can see areas of microaneurysms, we can see areas of stenosis and abnormal branching patterns and venous lakes consistent with tumors. And this shows us an example of abnormal branching patterns in an ovarian malignancy. abnormal branches, as you can see in this papillary cancer, and many features of the abnormal vascularity, as you can see here, and you can see on this 3D video clip of tumor vascularity with vessels that go from dilated to stenosed to dilated, a very abnormal pattern and a very characteristic pattern of tumor neovascularity. So in summary, I believe that the improved resolution with 3D and with contrast has some significant advantages over morphology in making the diagnosis of ovarian cancer. We can look at, of course, papillary excrescences, irregular or focally thickened wall, and presence of ascites as the morphology of ovarian cancer. But now with color Doppler, we can look at increased density of the vessels, abnormal vessel morphology, branching, and with contrast, we can see abnormal washout times and greater vascular volume in tumors. And I'd like to thank my group at Vanderbilt for their team effort in working on this topic, and hope that you have success in finding patients with early ovarian cancer. Thank you.